Hi all, welcome to the video. Today we are discussing about the growth and development. The first part is uploaded in the channel. This is the second part. In this video we are discussing about the methods of studying growth. Methods of studying growth. The growth can be studied by so many methods. First of all, we have to measure the growth. So, growth measurements are classified as measurement approaches and experimental approaches. Measurement approach and experimental approach. In measurement approach, we are measuring the growth in the organism itself. In experimental approaches, we are doing some experiments in animals and then measuring the growth. So, measurement approach includes craniometry, anthropometry, cephalometric radiology, and three-dimensional radiology. Experimental approaches include vital staining, radioactive tracer, autoradiography, and implant radiography. The next method of classification of growth measurements is direct and indirect. In direct method, we are taking measurements directly from the organism. It includes anthropometry, vital staining, histology, and histochemical implants. In indirect method, we are using impression cast, photography, radio photographs or radiographs for measurement of growth. The highlighted points, the highlighted methods are the ones we have to study. So, first method of studying growth is measurement approach. In measurement approach, there are mainly three methods. First one is craniometry. Craniometry means the measurement of cranium. So, to measure the cranium directly, the individual must be a cadaver, or it must be a fossil, or it must be a non-living individual. Then the next one is anthropometry. Anthropometry is carried out in a living individual. So we cannot measure the cranium directly. So we are using some soft tissue points corresponding to the cranium. So in anthropometry, we are using some soft tissue points corresponding to the cranium. The next one is cephalometry. Cephalometry is a radiographic method. It is introduced by a person called Broadbent in 1931. So with the use of this cephalometry, we can take serial radiographs of patients and to assess the growth changes. Serial radiographs of patients in periodic intervals, and thereby we can assess the growth changes. So this cephalometry can be used as a valuable aid in orthodontic diagnosis, orthodontic treatment planning, and also to assess the treatment results. So cephalometry is a radiographic method. We can using cephalometry we can take serial radiographs of patient at periodic intervals to assess the growth changes. So cephalometry is a valuable aid in orthodontic diagnosis, treatment planning, and assess the treatment results. It is introduced by Broadbent in 1931. The second method of studying growth is by experimental method. Experimental approach. In experimental approach, the first one is vital staining. The vital staining is introduced by a person called Belchier in 1936. Belchier observed the bones of animals that had eaten madder plants were stained red. This red color was due to the dye present in the madder plants called alizarin. So he extracted the dye alizarin and used in bone research. So in vital staining, we first of all we have to administer the dye into the animal. Administer the dye into the animal. Then this dye gets incorporated into the bones of the animal. Then after killing the animal, we can observe the or study the site of growth, direction of growth, duration of growth, and amount of growth. So vital staining. Vital staining was introduced by Belcher in 1936. Belcher observed that the bones of animals that had eaten madder plants were stained red. The red color was due to a dye called alizarin present in that madder plants. He extracted the dye alizarin and used in bone research. So in vital staining technique, first of all we have to administer the dye into the experimental animal. Then the dye gets incorporated in the bones of the animal. To study the site, direction, duration and amount of growth, we have to observe the patterns of bones of the animal. The second method in experimental approach is the radioisotopes. Radioisotopes. Radioisotopes are certain elements or compounds when injected into the tissue gets incorporated in the developing bone. These act as in vivo markers. So first of all these radioisotopes are injected into the tissue of the animals or into the tissue. Injected into the tissue, then these radioisotopes are isotopes get incorporated into the developing bone and act as in vivo markers. These can later be detected by tracking down the radioactivity they emit. Then these radioisotopes are detected later by the radioactivity they emit. The commonly used radioisotopes are technetium-33, calcium-45 and potassium-32. The commonly used radioisotopes are technetium-33, calcium-45 and potassium-32. The next one in the experimental approach is the implant placement. This implant the use of implants for studying growth was introduced by Bjork in 1969. Vital staining by Belcher in 1936. Implants by Bjork in 1969. In this technique, implanting of small bits of biologically inert alloys into the growing bone is done. They serve as radiographic reference point for serial radiographic analysis. First of all, we have to place or implant a small bits of biologically inert alloy into the growing bone. Then these implants serves as reference points for serial radiographic analysis. The implants used for studying growth are usually very tiny. Their measurements are 0.5 mm diameter, 0.5 mm diameter and 1.5 mm in length. 1.5 mm length and is made up of tantalum metal. So implants used to study growth has usually 0.5 mm diameter, 1.5 mm length and is made up of tantalum metal. So these implants are embedded in certain areas of maxilla and mandible in order to study the growth of the skull. So we can look into the sites of mandible and maxilla where the implants are placed. So first in case of maxilla. In case of maxilla, hard palate behind the deciduous canine. in hard palate behind the deciduous canine. This is deciduous canine. So behind the deciduous canine, before the erection of permanent incisors. Before the erection of maxillary permanent incisors, we have to place two implants behind the canines in the hard palate. Then below the anterior nasal spine. Below the anterior nasal spine. This is the anterior nasal spine, and below the anterior nasal spine after the erection of the maxillary incisors. Then two implants on either side of the zygomatic process of maxilla. Two implants on either side of the zygomatic process of maxilla. Then border between the hard palate and alveolar process medial to the first molar. Medial to the first molar. So border between the hard palate and alveolar process medial to the first molar. Here. These are the sites in maxilla where implants are placed. In hard palate behind the deciduous canine before the eruption of maxillary permanent incisors, then below the anterior nasal spine after eruption of maxillary permanent incisors, then two on either side of the zygomatic process of the maxilla, then border between hard palate and the alveolar process medial to the first molar. Then in case of mandible, first one is anterior aspect of the symphysis. Anterior aspect of the symphysis in the midline of the root tips. In the midline of the root tips, anterior region of the symphysis. Then two pins on the right side of the mandibular body. Two pins on the right side of the mandibular body. One below, one pin under the first premolar. One pin under the first premolar and the other below the second premolar or the first molar. One pin below the first premolar, second pin below the second premolar or the first molar. Then one pin on the external aspect of the right ramus at the level of occlusal surface of the molars. Outer surface of the ramus on right side in level with the occlusal plane. These are the sites in mandible where implants are placed. One is anterior aspect of the symphysis in the midline below the root tips. Then two pins on the right side of the body of mandible, one below the first premolar and second below the second premolar or the first molar. Then one pin on the external aspect of the right ramus at the level of the occlusal surface of the molars. These are the methods of studying growth. The next topic is mechanisms of bone growth. Mechanisms of bone growth. We all know that bone is derived from mesoderm. Bone is derived from mesoderm. Bone has mesodermal origin. So, bone form mechanisms of bone growth. First mechanism is bone deposition and resorption. Bone deposition and resorption. Bone deposition and resorption. Bone changes in shape and size by bone deposition and bone resorption. The process of bone deposition and bone resorption together is called bone remodeling. Bone remodeling. Bone deposition and bone resorption together is called bone remodeling. The changes that bone deposition and resorption can produce is by bone remodeling. The changes occurs are change in size, change in shape, change in proportion, and change in relationship of the bone with the adjacent structures. So by bone remodeling, a bone changes its size, shape, proportion, and its relationship with the adjacent structures. The second mechanism is the cortical drift. Cortical drift. Cortical drift. So cortical drift means A combination of bone deposition and bone resorption resulting in a growth movement towards the depositing side. Depositing surface is called cortical drift. That is, if we observe this picture, this posterior aspect of the ramus of the mandible here. The positive symbol means deposition, bone deposition, and the negative symbol indicates resorption. So here is a combination of bone deposition and bone resorption. As a result, there is a growth movement. Growth movement of the mandible occurs in the direction of the depositing surface. Mandible grows towards the depositing surface. This is called cortical drift. A combination of bone deposition and bone resorption resulting in a growth movement towards the depositing surface is called cortical drift. If bone deposition and bone resorption on either side of the bone are equal, then the thickness of the bone remains constant. If in case more bone is deposited on one side and less bone is resorbed on the other side, then the thickness of bone increases. And if resorption is more than deposition, then the thickness of bone decreases. So cortical drift means the growth movement towards the depositing surface. So a combination of bone deposition and bone resorption resulting in a growth movement towards the depositing surface is called a cortical drift. So here the posterior aspect of the mandible, here deposition occurs, and in the anterior aspect resorption occurs. So the growth movement of the mandible is towards the posterior surface. So this is called a cortical drift. The next mechanism of bone growth is displacement. Displacement. Displacement means the movement of the old bone as a unit. Movement of old bone. Movement of old bone as a unit. Movement of old bone as a unit. Displacement is of two types, primary displacement and secondary displacement. In primary displacement, if a bone gets displaced as a result of its own growth, it is called a primary displacement. A bone is displaced due to its own growth. Here the maxilla is displaced. Here maxilla is displaced forward and downwards. Forwards and downwards due to its own growth, maxillary growth. At the tuberosity region, the growth of maxilla occurs, and this causes displacement of maxilla in the forward and downward direction. Forward and downward direction. This is called the primary displacement. In case of secondary displacement, a bone gets displaced as a result of growth of the adjacent bone. Due to the growth of adjacent bone, a bone is get displaced. This is called a secondary displacement. In case of secondary displacement, we can take maxilla as an example. Here, maxilla get displaced in the forward and downward direction. Forward and downward direction due to the growth of this cranial base. Growth of the cranial base. Growth of the cranial base causes displacement of maxilla in a forward and downward direction. This is called a secondary displacement. And here, maxilla get displaced forward and downward due to its own growth. This is called a primary displacement. These are the main mechanisms of bone growth. Here is a schematic representation of bone growth. So, surface remodeling of a bone in opposite direction to that in which it is being translated by growth of adjacent structures creates a situation analogous to this cartoon, in which the wall is being rebuilt to move it backward. At the same time, the platform on which it is mounted is being moved forward. In this picture, the platform is moving towards the left side. The wall is reconstructed towards the right side. But on the total effect is this is moving towards the left. This is an example. So our maxilla is trying to expand like this. This is cranial base and this is maxilla. If this is maxilla and this is cranial base, maxilla is trying to expand like this. But as a result of this expansion, the maxilla get displaced to this direction. This is a schematic representation, same as the growth of bones. This is all about this video. So hope you all enjoyed the video and you understood the video. So in the next video we are uploading about the theories of growth. So in the previous video we discussed about growth, development, differential growth, the Scammell's growth curve and cephalocaudal gradient. And in this video we studied about the methods of studying growth. In the next video we will study about the different theories of growth. So thank you all.